Have you ever wondered what it would feel like to be told you have cancer? Now, imagine being told there's a new technology that could have found it years earlier, so small it was almost invisible. What if I told you that technology is not science fiction? It's here, right now, and it's powered by AI. This isn't just about data and algorithms. It's about giving people back their futures. Stick with me, because today we're diving into the revolutionary AI that's detecting cancer overnight and changing lives across the globe. Let's start with Sarah, a 42-year-old mother of two. For months, she had a nagging feeling something was wrong, but every test came back clear. Her doctors were stumped. Then she enrolled in a clinical trial for a new AI diagnostic tool. The AI scanned her results, not just looking for obvious signs, but for patterns so subtle they were invisible to the human eye. Within hours, it flagged a tiny anomaly. It was an aggressive cancer, but it was stage 1. Because of that early AI detection, Sarah's treatment was quicker, less invasive, and incredibly successful. Today, she's cancer-free, watching her kids grow up. Sarah's story isn't a one-off miracle. It's becoming the new reality for thousands. So, how does this incredible technology actually work? Imagine an AI that has studied millions of medical images, more than any human doctor could review in 100 lifetimes. It learns to spot the almost imperceptible changes in cells that signal the very beginning of cancer. Think of it like a superpowered detective that can find a single grain of sand on an entire beach. Traditional methods are great, but they often rely on a tumor growing large enough to be seen or felt. This AI can see the seed of the disease long before it becomes a tree. It analyzes everything from CT scans and mammograms to simple blood tests, cross-referencing countless data points in seconds. This isn't about replacing doctors. It's about giving them a powerful new ally in the fight against cancer. It's like giving a world-class surgeon a super magnifying glass that can see into the future. Now, let's meet David. David was a retired firefighter, a grandfather who loved hiking. A routine checkup included a new AI-powered blood test designed to screen for multiple types of cancer at once. He had no symptoms, no family history, and felt perfectly healthy. The test, however, lit up with a signal for early-stage pancreatic cancer, one of the most notoriously difficult cancers to detect early. His doctor was initially skeptical, but follow-up scans confirmed the AI's finding. It was a tiny, operable tumor that would have likely gone unnoticed for another year or more, by which point it could have been too late. David had surgery and is now back on the hiking trails with his grandkids. His story highlights the true power of this technology, finding the unfindable and turning a potential tragedy into a story of survival. The implications of this are staggering. We're talking about a future where a simple, routine checkup could screen for dozens of cancers simultaneously, with a level of accuracy we've only dreamed of. This is especially crucial for cancers that are often silent killers, the ones that don't show symptoms until they are advanced. By shifting the focus from treatment to ultra-early detection, we can fundamentally change our relationship with this disease. The goal isn't just to fight cancer better, it's to catch it so early that the fight is won before it truly begins. The emotional and financial toll of late-stage cancer treatment is immense. This technology promises to reduce that burden on patients, families, and our healthcare systems. Let's look at the science a bit more closely. This isn't just one single algorithm, it's a whole ecosystem of artificial intelligence. Some AIs specialize in image recognition, becoming experts at analyzing mammograms or lung scans. Others are masters of genomics, sifting through our DNA to find predispositions to certain cancers. And then there are the AIs that analyze liquid biopsies, the blood tests we mentioned with David. These can detect tiny fragments of DNA shed by tumors into the bloodstream. It's a complete, multi-pronged attack. What makes this so revolutionary is the speed and scale. A team of human pathologists might take days to analyze a complex case, An AI can offer a preliminary analysis in minutes, freeing up those human experts to focus on the most challenging cases and on patient care. It's a perfect partnership of human expertise and machine precision. But what about accessibility? Is this just a tool for the wealthy in state-of-the-art hospitals? The amazing thing is, the answer is no. Because AI is software-based, it has the potential to be incredibly scalable and affordable. Imagine a small rural clinic in a developing country. They might not have a team of specialist oncologists on site, but with a simple internet connection, they could upload a patient's scan and get a world-class analysis from an AI. This technology can democratize healthcare, bringing the highest level of diagnostic expertise to every corner of the globe. Organizations are already working on deploying these AI tools on low-cost devices, making early cancer detection a possibility for communities that have never had it before. It's about leveling the playing field and saving lives, regardless of where you live. Of course, with any powerful new technology, there are important questions to consider. We need to ensure patient privacy is protected, that the AI is free from bias, and that it's regulated properly to ensure safety and effectiveness. These are conversations that are happening right now among scientists, ethicists, and policymakers. The goal is to build a framework of trust so that everyone can benefit from this revolution responsibly. The collaboration between AI developers and medical professionals is key. The AI provides the data, but the human doctor provides the context, the empathy, and the final clinical judgment. It's a beautiful synergy. Think about the hope this brings. For generations, a cancer diagnosis has been one of the most feared moments in a person's life. But we are standing on the cusp of a new era, an era where our ability to see the disease early strips it of its power. The stories of Sarah and David are just the beginning. Soon, they will be the norm, not the exception. We are moving from a reactive approach to a proactive one, from treatment to preemption. The AI revolution in medicine isn't just a technological leap, it's a monumental leap for humanity. It's about more birthdays, more graduations, more time with loved ones, more hikes in the mountains. This is a story of hope, powered by human ingenuity. The scientists, engineers, and doctors building these AI systems are the unsung heroes of our time. They are turning data into days, months, and years of life. So the next time you hear about artificial intelligence, don't just think about self-driving cars or virtual assistants. Think about Sarah and David. Think about the lives being saved, the families being kept whole, and the future being rewritten. We are witnessing one of the greatest advancements in the history of medicine unfold right before our eyes. Thank you so much for joining me on this incredible journey today. If you found this story as hopeful and inspiring as I did, please hit that like button and subscribe to the channel for more content about the amazing technologies shaping our future. And I'd love to hear your thoughts in the comments below. Let's keep the conversation going.